viewers! Since childhood, we've all heard how important it is to floss our teeth. Just the other day, I was lectured by my dentist again. It's kind of why I wanted to talk to you today. There's a reason you've been told time and time again to floss. Turns out it's more important than you think. Let's talk about 8 things that happen when you don't floss your teeth. Is bad breath the least of your problems? What exactly is gingivitis? Will it change my beautiful smile? Wait, how can not flossing your teeth affect pregnancy? We're talking all that and more. Number 1. Bad breath. What do you think causes smelly breath? I can see most people linking it to a bad diet. For others, not brushing their teeth. While both of these are true, forgetting to floss is another common cause. At least when you brush, you're cleaning your teeth, but the bristles don't reach the tiny spaces between. If you don't floss, the food particles will stay stuck, only to invite plaque and bacteria. Let's talk about halitosis for a second. This is the overall medical term for bad breath, but is primarily used to describe a chronic condition rather than a temporary issue. If people have been noticing your bad breath for weeks, or you've noticed it yourself, chances are you have halitosis. Studies have shown that almost 50% of grown adults will experience some form of halitosis in their lifetime. When you floss your teeth, take your time with it, especially if it's your first time doing it in a while. Make sure you get all the plaque you can. Oh, and just so you know, you're recommended to floss once a day and brush twice. If you floss more than once a day, your gum tissue will suffer some serious damage. It's also good not to floss too hard. This way your gums won't start bleeding. You don't want your entire mouth hurting. How long have you gone without flossing your teeth? How long without brushing? Sound off in the comment section and start a conversation with our bestie community. Number 2. Gingivitis. If you're not flossing on the regular, you're gonna irritate your gums. This is gingivitis. It occurs for a couple reasons. The one we're talking about is dental plaque-induced gingival disease. Aside from medications, this is primarily caused by plaque and bacteria that has accumulated in your mouth. This is why you need to floss your teeth carefully. After a while, you'll begin to notice your gums getting puffier. They will also begin to bleed when you finally do floss. If you're experiencing gingivitis, not only should you start flossing and brushing, you're also recommended to use antiseptic mouthwash. Number 3. Periodontitis. If you don't take care of your gingivitis, periodontitis is what it develops into, also known as gum disease. This is where the soft tissue of your gums becomes damaged. Over time, it'll also affect the bone that supports your teeth. Here's what happens. The bacteria accumulates over the surface of your tooth. As a way to react, inflammation will occur. This is your immune system trying to help. Aside from not flossing, another thing that can cause periodontitis is smoking. A regular smoker is at a much higher risk of developing gum disease than a non-smoker. Number 4. Heart disease. If your gum disease goes untreated, it may result in severe damage to your heart. While the direct link isn't fully confirmed, there has been a ton of research done on this link over the years. As it turns out, people with gum disease are 2 to 3 times more likely to suffer a heart attack or stroke. The bacteria that builds up around your teeth will eventually move inside. Over time, a new type of plaque will build up in your arteries. This is made from fat, calcium, and cholesterol. This is known to cause coronary artery disease. A while back, scientists did an experiment on rabbits to see the reaction to certain foods and how their diet would affect their heart. For the test, the animals were given food that was rich in cholesterol. As a result, many of the rabbits developed bacteria that caused periodontitis. They ended up having plaque built inside of their arteries, which led to cardiovascular disease. The rabbits who weren't fed cholesterol-rich foods were found not to be at a greater risk of heart damage. The mouth is a portal to the rest of the body. If your teeth aren't as healthy as they should be, your body is surely going to feel it. Aside from heart disease, plaque buildup and gum disease have been linked to things like arthritis and diabetes, not to mention a few things we'll be talking about real soon. Number 5. Cavities. Oh, the cavities! Since you were little, you've heard from every adult how not taking care of your teeth leads to terrible, painful cavities. Well, this includes forgetting to floss. If flossing is the cause of your cavity, it's either because you haven't been flossing hard enough or you're not cleaning those hard-to-reach areas. Keep in mind that much like heart disease, the connection between flossing and cavities hasn't been fully confirmed. But we all know by now what happens to your teeth and gums if you're leaving plaque to sit for an extended period of time. The bacteria is gonna rot your teeth. Number 6. Yellow teeth. If not for cavities, heart disease, and bad breath, at least floss helps to avoid yellow teeth. But doesn't simply brushing prevent this? It's a little more complicated than that. Bad hygiene in general will give your teeth a yellowish tint, but not flossing is particularly awful. The buildup of plaque between your teeth will eventually spill into your pearly whites. Over time, you'll begin noticing a weird stain on your tooth enamel. This may be the reason you're beginning to see the outline of your tooth turning yellow. It will gradually move further inward, eventually covering the entire tooth. If you want to avoid yellow teeth, you need to both brush and floss on the regular. It's also good to have regular visits to the dentist if possible. Make sure that you start taking care of your teeth because as you get older, the stains will be permanent. Before we continue, is your cholesterol level healthy? Check out our recent video discussing 8 foods that can lower your cholesterol level. Now back to our discussion on what happens when you don't floss your teeth. Number 7. Tooth loss. Your teeth turning yellow isn't the only way your smile can be ruined. Forgetting to floss can lead to your teeth falling out. If you're suffering from dreaded gum disease, your gums will eventually pull away from your teeth. This leaves more space for bacteria to come in. Once the bacteria is fully settled, the structure of your teeth will begin to weaken, loosening your tooth and ending with it falling out. It's not just the gums that are suffering up until this point. Chances are the tooth will be long past the point of assistance once it falls out. Around this time, your tooth enamel will be eaten by bacteria. Yellow teeth look healthy compared to them. If they're not falling out, the loss of tooth enamel might cause your teeth to shift instead. This can really make things uncomfortable as your mouth might become too crowded. An overcrowded mouth will make it much harder for you to floss out plaque, as the spaces in your teeth will be smaller. This in turn will lead to bacterial infection and possible tooth loss. As for your periodontal bones, you might even begin to lose them. Number 8. Problems during pregnancy. Remember how I said that the mouth is a portal to the rest of the body? Well, this is one of the more terrifying examples of that. When a woman is pregnant, the level of bacteria throughout her body needs to be controlled. This prevents the risk of infection. Unfortunately, bacteria in the mouth is often overlooked. Since the exhaustion that comes with pregnancy can be overwhelming, brushing and flossing are often forgotten, only adding to the issue of oral hygiene. If you're pregnant and not looking after your teeth, the bacteria from your mouth will make its way into the bloodstream. This can result in low birth weight for babies, which is why you need to pay extra attention to your gums. Remember gingivitis? Well, hormonal changes during pregnancy can lead to gingivitis, not to mention some of the morning sickness that takes place. This can also surprise the mouth with unwanted bacteria. The stomach acid can burn through your tooth enamel. Another reason to floss during pregnancy is the amount of snacking that goes on. Pregnancy can invite a taste for sweets. The sugar that gets in between your teeth can really do some damage. Do you floss your teeth on the regular? Are you considering doing it more now that you've watched this video? Let us know in the comments below. We would love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.